Today we're tackling a topic that might feel a little scary, but it's one of the most important conversations we can have about our health. How many times have you noticed a strange ache, a new lump, or a change in your body and thought, it's probably nothing, or I'm just too busy to deal with this right now? We've all been there. As women, we often put everyone else's needs before our own. But here's the truth. Your health is not negotiable. Catching cancer early is one of the most powerful tools we have. It dramatically increases treatment success and can save lives. So, in this video, we're not here to fearmonger. We're here to empower. We're going to walk through 6 symptoms that you should absolutely never ignore. Remember, having one of these symptoms does not mean you have cancer. In most cases, it's something far less serious. But it does mean it's a signal from your body that deserves a conversation with your doctor. Let's get started. Symptom 1. The unusual lump or mass. Let's start with the most well-known symptom, but one that's often misunderstood: an unusual lump or mass. We all know to check for lumps in the breasts, and that's crucial. But what exactly are we looking for? It's not just an obvious, painful ball. Be on the lookout for a hard, immovable lump with irregular edges, a thickening or firmness that feels different from the rest of the breast tissue. Any lump in the underarm area. And this is important. Lumps aren't just for breast cancer. A persistent lump in your neck, your groin, or anywhere else could be a sign of a swollen lymph node, which can be associated with lymphomas or other cancers. If you find something, don't panic. Schedule an appointment with your doctor. They can determine if it's a benign cyst, a fibroadenoma, or something that needs further investigation like a mammogram or ultrasound. Knowing your own body through regular self-checks is your first and best defense. Symptom 2. Unexplained vaginal bleeding or discharge. Symptom number 2 is one that many women feel uncomfortable talking about, but we need to break that stigma. Unexplained vaginal bleeding or unusual discharge. Now, what does unexplained mean? Bleeding after menopause. This is a red flag that should never, ever be ignored. Postmenopausal bleeding is the most common symptom of endometrial uterine cancer. Bleeding between periods or much heavier periods than usual. Bleeding after sex. Watery, pink, or foul-smelling discharge that is unusual for you. I know it can feel embarrassing, but your gynecologist has seen and heard it all. They're there to help, not to judge. These symptoms can be caused by many things like fibroids, hormonal changes, or infections, but because they can also be signs of cervical or uterine cancers, they warrant a professional EV. If you have these symptoms nearly every day for a few weeks, please write them down and see your doctor. Track your cycle too, so you can say with confidence, this is different from my normal PMS. Symptom 4. Changes in bathroom habits. Our bodies have a rhythm, and significant changes in our bathroom habits are a major signal. Symptom 4 is all about what's happening in the bathroom. For your bowels, watch out for persistent constipation or diarrhea. A change in the caliber of your stool if it becomes consistently pencil thin. Blood in your stool, which could be bright red or dark and tarry. A feeling that you haven't fully emptied your bowels. And for your bladder, blood in your urine, hematuria. Pain or a burning sensation when you urinate. Host leans in slightly, emphasizing the point. Again, these are most likely signs of something less serious, like hemorrhoids, IBS, or a UTI. But blood in your stool can be a sign of colorectal cancer, and blood in your urine can be a symptom of bladder or kidney cancer. Don't assume it's just a hemorrhoid. Let a doctor make that call. Symptom 5. Unexplained weight loss and fatigue. A symptom number 5 might sound like a goal for some, but in this context, it's a warning. Significant, unexplained weight loss and profound fatigue. We're not talking about the weight you lost because you started a new diet or exercise routine. This is losing 10 pounds or more without trying. When it comes to fatigue, this isn't just "I need more sleep" tiredness. This is a deep, unshakable exhaustion that doesn't get better with rest. What's happening here? Cancer cells can use up a huge amount of your body's energy, and release substances that change how your body processes food, leading to this unexplained weight loss and fatigue. It's a common symptom with many cancers, including leukemia, lymphoma, and others. If you're eating normally, but the pounds are falling off and you're constantly drained, it's your body asking for help. Symptom 6. Persistent skin changes and sores. Our final symptom is one you can see: persistent changes in your skin. We all know to look for changing moles, which can be a sign of melanoma. Remember the ABCDE rule. A for asymmetry, one half doesn't match the other. B for border, irregular, scalloped, or poorly defined borders. C for color, varied colors from one area to another. D for diameter, larger than the size of a pencil eraser, but can be smaller. E for evolving, the mole is changing in size, shape, or color. But also pay attention to any sore that doesn't heal, a new lump or spot that appears, or a spot that starts to itch, bleed, or crust over. This applies to your skin anywhere, including in hidden areas. When in doubt, get it checked out by a dermatologist. A simple biopsy can provide a definitive answer. So, those are the 6: unusual lumps, unexplained bleeding, persistent bloating, changes in bathroom habits, unexplained weight loss, and persistent skin changes. I know that can feel like a lot, but I want to leave you with one final crucial message. You are your own best advocate. No one knows your body like you do. If something feels off, if a symptom is persistent and unusual for you, trust that instinct. Don't let fear talk you out of making an appointment. Don't let a busy schedule be the reason you delay. Your doctor is your partner. Walk in, be clear, and say, "This is what I'm experiencing. It's been going on for X weeks, and it's not normal for me." Your health is your greatest wealth. Let's promise to stop ignoring the whispers so our bodies never have to scream. If this video was helpful, please give it a thumbs up and share it with the women in your life, your sisters, your mothers, your friends. You never know whose life you might help save. And subscribe for more content dedicated to taking the fear out of your health. What is one symptom you've been putting off getting checked? Promise yourself you'll make that call today. Share your commitment in the comments below for accountability. Thank you so much for watching. Take care of yourself. I'll see you in the next video. This video is for educational purpose only and does not constitute medical advice. Please consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health.